My name is James Polli, and I would like to speak with you about drug transporters and oral drug absorption. We'll be talking about a few different topics, mostly spending our time talking about transporter basics, as well as drug interaction studies. Additionally, speaking just a little bit about the BCS and predicting drug disposition, as well as a little bit about prodrug design design that targets transport. So there's certainly an intestinal transport metabolism conundrum. It's a difficult area, this area of intestinal transporters. As you generally know, GI physiology plays a role in drug absorption, drug physicochemical properties, biopharmaceutical properties, metabolic and transport pathways all affect PK. And then on top of that, contemplating transporter effects that can have an effect. And it really brings about even a higher level of complexity. So unfortunately, the role of transporters in oral drug absorption is generally difficult to elucidate. It's difficult to elucidate because of the ability of the drug in question to be translocated by transporters is often poorly understood. You can have more than one transporter that can have an effect, and they can work in opposite directions, in fact. Transporter expression level and scaling methods of in vitro findings don't do very well in vivo in general. There's lots to be developed there. And additionally, it's very difficult to assign specificity of transporter with the drug. And then finally, passive permeability, which is a parallel process to a transporter effect, is a competing pathway. So that makes it even harder to elucidate really if a transporting is having an effect or not. So unfortunately, even though there's been decades now of research on transporters, probably that research hasn't contributed to development in many practical ways. For example, let's say if a drug is suspected to have an efflux transporter that's minimizing or reducing bioavailability. Identifying ways around that to inhibit that effect, unfortunately, are not well elucidated. We'll be talking about drug-drug interaction studies, and unfortunately, those types of designs are still difficult to design and get clear results. And then the idea of designing prodrugs that leverage a transporter, unfortunately, is not